Greetings to everyone. This is Dr. Mudasir Rashid, MD Pathology. The title of my presentation is Evaluation of Iron Deficiency Anemia in Pregnant Females and Correlation of Red Cell Indices with Serum Ferritin. Under the supervision of Dr. Arvind Khujuria, Head and Professor of Department of Pathology, SCOMS, Acharya Sri Chandra College of Medical Science and Hospital, Jammu. The outline of my presentation is including introduction, review of literature, aim and objectives, material and methods, plan of statistical analysis, results and conclusion. Now coming to the introduction, anemia is defined pathophysiologically as a decrease in oxygen carrying capacity of blood. Anemia in pregnancy is a major health problem, especially in developing countries like India. Nutritionally, iron deficiency is the main cause of anemia throughout the world, especially in the women of reproductive age group and particularly during pregnancy. Also, there is a blood loss during pregnancy, which along with adequate dietary intake and absorption of iron contributes to anemia. Iron deficiency anemia is defined as a decrease in total body iron content, and World Health Organization has estimated that prevalence of anemia in pregnant women was found 14% in developed and 51% in developing countries and 65 to 75% in India. World Health Organization defines anemia in pregnancy when hemoglobin concentration in peripheral blood film is 11 gram per deciliter or less. Early detection and treatment of subclinical iron deficiency among non-pregnant women may play a vital role in preventing development of anemia in pregnancy. Deficiency of iron results when iron losses requirements exceeds absorption and is often multifactorial. The amount of iron in diet, its bioavailability determines the iron absorption. The iron demand are markedly increased during pregnancy because of expansion of red cell mass and transfer of increasing amount of iron to both developing factor and placental structures. Approximately 1000 mg of iron is required to meet the metabolic demands during normal pregnancy, and the degree to which the iron demands are met depends upon the iron reserves at the beginning of pregnancy and amount of dietary iron absorbed. Diminished intake of iron because of socio-economic factors, faulty dietary habits, loss of appetite and vomiting in pregnancy are the various other factors that contribute to iron deficient state during pregnancy. Iron deficiency is by far the most common cause of anemia in general and microcytichypochromicanamia in particular. Iron deficiency anemia develops as the end result of a series of steps that begin by depletion of iron stores. The most vulnerable group to iron deficiency anemia are pregnant females and infants, as the iron demands and requirements are increased in them. It is frequent for iron deficient state to develop during pregnancy, indicating that the physiological adaptations during pregnancy are often insufficient to meet the increased iron demands. Now coming to the literature review, I have mentioned a few authors. Tiwari et al. Studied 100 pregnant females. Abdel Gader et al. In 2014 studied 100 pregnant females and found that combined reduction of red cell indices including MCCRT is more sensitive to detect iron deficiency anemia, while MCHC reduction comes late. And Tiwari et al. Also studied 100 pregnant females and also concluded that including red cell indices, also hemoglobin with serum ferritin levels in iron deficiency anemia cases, whereas RBC count shows some correlation with serum ferritin. Veena et al. In 2013 also concluded that iron deficiency patients are closely correlated or analysis of iron stats of the patient, and thus also helps in taking the necessary interventions to prevent the adverse outcome. Singh et al. In 2019 studied a total of 1193 females. Out of 1193 females, 384 were pregnant, 400 lactating and 407 non-lactating or non-pregnant females. They also found that about 80.7% pregnant women were anemic. Now coming to the aim and objectives of this presentation, it is to correlate red cell indices with serum ferritin in pregnant females with iron deficiency anemia. Now, materials and methods. The study was conducted in the postgraduate Department of Pathology in collaboration with Department of Obstetrics and Gynecology, Acharya Sri Chandra College of Medical Science and Hospital, Sidra, Jammu, after obtaining due clearance from the Institutional Ethics Committee. The study was conducted over a period of 1 year and 100 patients were evaluated for this observational study. Pregnant females with anemia diagnosed during study period formed the study group, and written informed consent was obtained from all the patients after explaining them the nature and purpose of the study. The patients were enrolled according to the following inclusion and exclusion criteria. The methods in this presentation used are hemoglobin estimation, reticulocyte count, and iron studies. Now coming to the inclusion and exclusion criteria. Inclusion criteria including pregnant females presenting with anemia, hemoglobin 11 gram per deciliter or less, and exclusion criteria were pregnant females with hemoglobin within the normal range and pregnant females suffering from any systemic disease. Plan of statistical analysis. The statistical analysis was done and the results were expressed as percentage, and other appropriate statistical methods were applied wherever necessary. The results were expressed with appropriate charts and diagrams. Now, results. Majority of the pregnant females in the present study had normal MCV, whereas almost similar number of females had reduced MCV.